You sound terrible. How long are you going to have this cough for? It's Diagnose Matthew Holt on this episode, the December 7th episode of Health in 2.0.
I drank some beer.
It's not going to help you. Oh my God, just get an antibiotic. I cannot with this cough anymore.
It's only been 3 weeks. I don't have COVID.
Bronchitis, a sinus infection. I'm cured. I moved on to the next thing. And here you are with the same cough from Europe. I guess this is par for the course from a man who has pulled back out the interview sweater that has plagued this show like a cough how many years now? We're celebrating almost 4 years of the interview sweater. Fun fact, loyal viewers, this sweater was the sweater that Matthew Holt would wear basically every episode for like the first 50 episodes that took place in the winter of 2018 when we first started Health in 2.0. And it's good to know that it's still there and that it's made its annual reappearance.
Winter is coming, as they say. I actually never saw Game of Thrones, so I'm not quite sure what they said Winter is Coming was about, but
it was not good. It was not good.
Winter shouldn't come?
Yeah, I can explain it to you, but this is a longer conversation.
Okay, well, there's no snow in Tahoe yet, so I'm not sure how I go skiing.
I don't know. Maybe your winter sweater is good luck. In fact, in the first episode, we teased about the fact that you looked like you had a big beard and we were wearing that sweater. And it was right after Groundhog Day in February of 2018. And I said that you looked like winter. It hit you really hard.
Oh, I think I said I was auditioning as the groundhog.
That too.
All right, we should
so maybe here comes the Tahoe snow.
Okay,
are you ready?
Yeah.
All right.
I can't hit the start button. There it is.
Of course not. It's still not going.
It's going.
Okay, Quartet gets $60 million, brings our total up to 153. Independence Blue is in this. Oak is in this. Google Ventures is in this. Matthew, why?
I am struggling to understand this because Quartet is narrowing down what it does. It basically is now doing sort of diagnosis and spreading you across a network. It doesn't have its own therapist, unlike Lyra or Ginger. It's basically going to plan to say, we will figure out for your primary care doctors what kind of therapists these people should go see. And it's just being that network switch in the middle. Diagnosing people with mental health issues is a big problem. So maybe that's why they've convinced them. But it strikes me as that they've raised, $150 million. Probably the valuation is probably on the way to $1 billion. And it's a tool, not an entire service.
All right. More gold medal investors here into this next company. Lyn Health gets $43.5 million. General Catalyst, Andreessen, and Sachin Jain are in this one.
Sachin Jain is doing VC fund these days, and actually Scan Healthcare, which he heads up, is doing quite a lot of investing at the moment. This is absolutely typical healthcare problem. Provider lists and getting the right provider list to figure out which provider takes which insurance and does this, that, and the other. It's a complete mess, and Lyn is going to fix it. We'll find out how well. We'll interview them shortly.
We will. All right. Lyn Health comes out of stealth. Speaking of interviews, they've got $10 million from Summer VC. This is a polychronic provider group is what you've told me.
They've reinvented how to do a medical group. It's brilliant. I don't know how Kaiser Permanente missed this all those years ago. Actually, it's good because they're going to pick just the people who are actually very sick, and they are going to do a virtual medical group for them. How it fits in the rest of the world, I don't know. And they great interview and excellent fashion sense.
Okay. Medallion gets 30 million, brings their total up to 50. Sequoia, Optum Ventures, and Oscar Health's co-founder is in this one.
Yeah, this is more great stuff. This is credentialing for providers across state lines, very necessary for all those virtual first customers.
All right, Safely You.
Oh, you just hit it. Go on.
Should we sing the song? Safely You. Can something else?
Safely You in the song, but go on.
What? Safely You gets $30 million, brings their total up to 49.5. Omega's in this. Scan and DCBC. What do they do?
Interesting. So this is really clever stuff. I think these guys were at Health 2.0 in Japan. Health 2.0 in Japan about 3 or 4 years ago. If it wasn't them, it was someone like them. It was a Stanford group with the early stage technology. So they take videos of people in nursing homes predominantly, And with the video, they can start figuring out if somebody is limping or doing whatever. And the AI tracks it. Mrs. Smith in room 78 or whatever, maybe at risk of a fall. And they apparently have cut falls and admission to ERs for falls from by about a factor of 5. Very clever stuff.
Oh, wow.
Really clever. And it's obviously got a great use case because falls in nursing homes lead to broken hips, lead to all kinds of bad stuff and death. And raised 50 million overall. 10 million of that of the raise. They were next to it. Well, it was not in the 30 million, but 10 million, which was reported as VC money, but it wasn't actually, was from their main investor, which is a chain of nursing homes, Omega, is revenue. So although it's reported, it's much better to get. So they got 10 million guaranteed prepaid revenue to put this in all their systems. So that's a big spot. This is a really interesting niche thing. I don't know if it's the one we saw in Tokyo or just like the one we saw in Tokyo, but super cool.
That's awesome. Very cool.
Yeah. I wonder what their sweaters are like.
Their sweaters.
Or their,
you're so into fashion now. I don't even understand. And
come on, you interviewed a guy from Seattle wearing a grunge flannel shirt. He might as well have been playing Soundgarden and Nirvana in the background. You're too young. You don't know this. In the early 90s.
No, I totally know this. I'm looking at a man whose wardrobe,
and the guy from,
I'm looking at a man whose wardrobe consists of Health 2.0 t-shirts of various vintages over the last 20 years or so, and this one sweater. Okay, so excuse me for being a little bit skeptical about the fact that you're weighing in about what Rick Cabot had on in the interview that he did with me.
All right, but I'm not a highly paid CEO who's raised $10 million who could buy myself a fancy suit with the money. I have to rely on what I've got lying around the house.
Oh my God. Our fashion tips. Follow along with this paragon of style over at Bolty Boy on Twitter. Oh my God. Meanwhile, reporting on healthcare, it's just me over there at Just Amasa, staying in my lane. Okay. Oh no, here's that cough again.
You're a elegant and fashion conscious person. You look
don't even weigh in on me, okay? I don't want to know what you think about my dress, my style, okay? My dress, my style. I don't want to know.
I've never seen you wearing a grunge shirt.
The healthcare blog, not the fashion healthcare blog, okay?
Didn't you tell me that we should be like, what's that fashion blog you like so much?
This is the fashion.
You told me that's what we should be like.
You're not that part of it. I meant in making millions of dollars. Like, I did not mean in weighing in on what people were wearing. Oh my God. Come for the healthcare bullshit, stay for the fashion. Bonus coughing. If you can diagnose Matthew, you think you know what he might have, please be sure to reach out to us.
I'm going to see my doctor later on today, so maybe.
Oh, thank God. Can't wait to see that.
I think he's mostly going to tell me I'm too fat, but otherwise he might.
Well, I'm sure that has nothing to do with your cough, but please live tweet the whole experience. We'd love to know. All right. And I'm going to just now promote the email newsletter so that we can get the heck out of this episode. It is at thehealthcareblog.com. You can sign up there and receive all of the merriment of the blog delivered directly into your inbox. I know. How about that for some stuff? Lots of great content from our contributors, as well as my WTF Health interviews with or without fashion commentary provided on the people who are in them.
All right. You should say goodbye.
I hope you feel better.
We'll see. Either that or I'll get cured or I won't. One or the other.
The beer is not going to be the thing, okay? I'm going to tell you that right now. Spoiler alert.
Beer is medicine. They say food is medicine and beer is...
Now, whiskey, then we'd be talking. All right, bye.